personally salute all frontliners who have worked tirelessly and innovators who have yielded a solution to prevent and treat COVID-19 and other crisis situations, or an initiative which has contributed towards mitigating the impacts of coronavirus and providing relief to communities. I have observed abundant creativity and innovation emerging at the national, institutional, organizational, and individual levels for the past year.
Now is the ideal time for initiatives like this to be explored, not only encourage development of innovation, but to manage future emergencies and crises.
Sejak mencapai kemerdekaan, Malaysia telah mengalami transformasi yang pesat demi kemakmuran dan kesejahteraan rakyat. Sektor kesihatan, antara sektor terpenting negara, sentiasa berhadapan dengan pelbagai isu dan cabaran dalam era globalisasi ini. Fokus Kementerian Kesihatan menjadi lebih luas, terutamanya dalam menyediakan kemudahan kesihatan yang saksama, mudah diperolehi dan berkualiti. Untuk itu, perancangan dan pelaksanaan program kesihatan negara perlulah berasaskan kepada bukti saintifik menerusi hasil-hasil penyelidikan yang berkualiti. Penubuhan Institut Kesihatan Negara atau NIH yang bernaung di bawah Program Penyelidikan dan Sokongan Teknikal Kementerian Kesihatan Malaysia adalah bertujuan untuk menjalankan penyelidikan yang mana hasilnya dapat memberi bukti saintifik terhadap pembentukan polisi dan intervensi bidang kesihatan. NIH telah diluluskan di bawah rancangan Malaysia ke-7 dan secara rasmi beroperasi sejak bulan Ogos 2003. Visi NIH adalah untuk menjadi organisasi penyelidikan kesihatan terkemuka ke arah meningkatkan kesihatan dan kesejahteraan negara. Manakala misi NIH adalah menjalankan penyelidikan, latihan dan perundingan berkaitan kesihatan yang berkesan dan berimpak tinggi untuk meningkatkan kualiti hidup. Selain itu, NIH juga bertanggungjawab untuk mentadbir dan menguruskan penyelidikan di negara ini untuk menangani isu-isu kesihatan nasional. Kompleks NIH seluas 40 ekar di Setia Alam Selangor mempunyai ciri-ciri seni bina moden yang melambangkan kerancakan transformasi perkhidmatan kesihatan yang dizahirkan oleh penyelidikan yang berkualiti tinggi. Dilengkapi dengan pelbagai fasiliti serba moden, NIH turut menekankan kepentingan ekosistem alam sekitar yang mampu mewujudkan suasana kondusif untuk penyelidikan. Kompleks NIH menempatkan sebanyak 6 buah institut yang mempunyai pengkhususan dalam bidang penyelidikan masing-masing. Kelancaran operasi setiap institut ini disokong oleh pejabat pengurus dan pejabat pendaftar yang menjadi tunjang utama dalam pengurusan strategik dan pentadbiran NIH. Institut Penyelidikan Perubatan atau IMR merupakan institut penyelidikan biomedical tertua di Malaysia yang diwujudkan sejak tahun 1900 oleh Kerajaan British. Ketika itu, ia dikenali sebagai Institut Pathology di Kuala Lumpur. Hasil penyelidikan IMR telah banyak menyumbang kepada pengetahuan, pemahaman, rawatan dan kawalan beberapa penyakit tropika utama di negara ini dan rantau Asia Tenggara. Kini, fokus IMR juga kepada penyelidikan bioperubatan seiring dengan trend perubahan isu dan beban kesihatan negara serta kemajuan teknologi perubatan. Sejarah Institut Kesihatan Umum IKU bermula di Singapura sebagai Royal Sanitary Institute dan dijenamakan sebagai Royal Society for Promotion of Health RSH yang berperanan melatih inspektor kesihatan dari Tanah Melayu, Singapura dan Borneo. IKU berkembang menjadi pusat penyelidikan epidemiologi dan kesihatan awam yang menyediakan data-data kesihatan penting pembuat dasar dan pihak berkepentingan mengenai prevalen penyakit dan taraf kesihatan rakyat negara ini. Antaranya adalah tinjauan kebangsaan kesihatan dan morbidity at National Health Morbidity Survey yang dijalankan secara berkala. Institut Penyelidikan Klinikal atau ICR berfungsi sebagai cabang penyelidikan klinikal KKM dan mula beroperasi sejak Ogos 2000. Dengan 5 buah pusat kajian yang berperanan menggerakkan kajian-kajian klinikal tersendiri serta mempunyai 36 cawangan di hospital-hospital utama KKM di seluruh negara. ICR memainkan peranan penting dalam menerajui pembangunan dan pengukuhan kapasiti penyelidikan klinikal negara, mewujudkan dan mengekalkan pengkalan data klinikal bagi KKM dan juga mewujudkan kerjasama dengan organisasi penyelidikan tempatan, serantau dan antarabangsa mengenai penyelidikan klinikal. Institut Penyelidikan Sistem Kesihatan atau IHSR ditubuhkan pada November 2002 bagi membantu KKM dalam pelaksanaan penyelidikan terhadap sistem dan pengurusan kesihatan negara yang membantu dalam menyediakan bukti saintifik kepada pengubal dasar dan polisi kesihatan negara mengenai taraf dan kualiti penyampaian perkhidmatan kesihatan kepada rakyat. Institut ini berperanan dalam melaksanakan penyelidikan berimpak tinggi dalam bidang penyampaian perkhidmatan kesihatan negara, melaksanakan penilaian terhadap dasar dan polisi kesihatan dan kebolehcapaian perkhidmatan yang saksama dan berkualiti dalam kalangan semua rakyat negara ini. IHSR telah mendapat pengiktirafan antarabangsa dan telah dilantik sebagai Pusat Kerjasama Serantau WHO untuk peningkatan kualiti dan kesihatan. Institut Pengurusan Kesihatan IHM bermula di bawah Institut Kesihatan Awam yang dikenali sebagai bahagian latihan pengurusan. Penubuhan IHM bermula pada rancangan Malaysia ke-6 yang mana ia bertanggungjawab dalam meningkatkan pembangunan modal insan profesional di KKM untuk menghadapi cabaran dalam penyampaian perkhidmatan kesihatan yang berkualiti. Bidang penyelidikan yang dipelopori oleh IHM ialah aspek kepuasan pelanggan, pengurusan sumber manusia serta pemantauan dan penilaian terhadap kualiti perkhidmatan kesihatan negara. Selain itu, IHM turut berperanan sebagai sebuah institut yang menyediakan latihan berkualiti tinggi kepada kaki tangan KKM. Institut Penyelidikan Tingkah Laku Kesihatan IPTK ditubuhkan pada 2005 adalah bukti bahawa bidang tingkah laku kesihatan adalah penting dalam usaha mencapai sebuah negara maju. IPTK bertanggungjawab dalam melaksanakan penyelidikan inovatif dalam bidang tingkah laku, penilaian intervensi promosi kesihatan, kaedah komunikasi kesihatan yang efektif dan komunikasi risiko. Penyelidikan yang dilaksanakan oleh penyelidik-penyelidik di NIH bukan sahaja telah memperbaiki penyampaian kesihatan kepada rakyat Malaysia, namun telah turut mendapat pengiktirafan di dalam negara dan di peringkat antarabangsa. Way Forward NIH akan terus mengkaji dan meningkatkan kepakaran para penyelidik ke arah menghasilkan kajian-kajian berkualiti dan berimpak tinggi dalam meningkatkan taraf kesihatan dan kehidupan rakyat Malaysia.
Ladies and gentlemen, our next lined up program is a knowledge sharing session. Please enjoy.
Ladies and gentlemen, hi! Today, National Cancer Society Malaysia will be conducting a cancer health screening for the community.
Cancer health screening? What for? Is it like a normal blood pressure machine and then all the height and weight measuring? My grandma also can do it at home.
Everything the same thing. I never see any new things here only.
Oh, no. Ladies, today we have this IIA, eye breast machine, to scan for lumps in your breasts. And guys, we have a PSA machine that comes to take venous blood from you, and then we will scan for prostate enlargement. The community health screenings that was being done all these years are phasing out as it is no longer seen as relevant to the people at large. The most commonly done blood pressure could be done at the comfort of our own homes with the purchase of a simple blood pressure device, or even the blood glucose test could be conveniently done from home without technical difficulties. But ever since the government's implementation of the Movement Control Order, MCO, much has changed. It has pushed us to go beyond our limitations. It has brought us great innovative ideas to step up our health screening programs offered to our community. We now could even screen for prostate enlargement through a portable point-of-care machine, simply by taking venous blood on the spot. Besides that, we also have the eye breast machine that we could do on the spot to scan for any breast lumps.
Wow, that's interesting. Yes, is it?
Yes, it's very interesting.
Would you like to try the health screening?
Yes, of course. Come, let's
Yeah,
go for
let's
the
go.
screening.
Sure, come along!
Hi, I'm Dr. Tasha from the National Cancer Society of Malaysia. I'd like to thank you for inviting us to your event. My topic for today is bringing cancer health screening to your doorstep. So before I start, I'd like to introduce my team. We've got Ms. Muller, our Clinical Services Manager. We've got Calvin, our registered nurse. We've got Julian, Lukman, Tulasi, and Ian, our program coordinators, and Kavinash is our community support executive. So a big thank you from all of us. So why is the community outreach program so important? Firstly, we are here to bring services to you, to provide for you. We are hoping to get to the hard-to-reach population, like those living in the outskirts, in villages, in the rural areas. We'd like to bring our screenings to them. I understand that they've got travel issues, transport issues. Getting to primary or secondary tertiary care centers is not easy. So, us being mobile, us being able to go out and come to you, it would be very helpful and easy for them to get basic checks done. Secondly is the lack of awareness of health issues. Many people aren't aware of the health hazards of obesity, diabetes, hypertension, cancers, or just their general health condition. Financial constraints is another thing. People aren't able to afford basic health checks, body checks, screening, blood tests. So thanks to NCSM, we are here. I can come to you and get all these done at a very, very low cost or for free. So what we do now, as we all know, MCO has taken quite a toll on all of us. Things have changed. We've gone online. We go out less. We also did not do much community screenings during MCO, so we had this time to kind of add stuff. So I'm just going to share that with you now. So firstly, we've got the eye breast. This supersedes the clinical breast examination, but of course it's not as, it's not a mammogram, but it's an amazing screening device that helps us detect lumps up to 3 millimeters in size. It's portable, it's mobile, it's light, it's easy to use. user-friendly. We can get reports. With our reports, we can give the reports to these specialists and they can act on it accordingly. Next, we've got the PSA analyzer. So as opposed to getting a full blood test with all the tumor markers, this one, you can just get a little venous blood sample and you can run a test to look for your PSA reading. It takes only 15 minutes to get the results. So it's fast and quick, and should it be raised, we would refer them to the clinic. Consultations, now we are able to do online consultations or telephone calls. So, for example, if you've got a positive pap smear test, we would call the patient and inform them of the results, and then we'd explain the results and ask them if they've got any concerns or answer any questions, and we would also advise them on what to do next. If there be a need, we'd call them to the clinic for a face-to-face consultation. We will make sure that they are referred to the appropriate specialist or clinic. Follow-up calls. We will do follow-up calls for positive tests. Like again, using the pap smear example, if it's positive, we would make sure we call them up at least 3 times to see where they are in their management plan, or if they've seen the doctor who they're referred to, where they are in the treatment plan, if they've started their management. The aim of this is to make sure they are not they're acting on the positive tests and not ignoring it or just leaving it. We want to make sure these things are acted upon. So next we've got the handheld spirometer. I think you're all familiar with the older one. It's huge, it's bulky, it's not very portable, it's not very, you need to be trained to use it. And this one, of course, we need to train, but it's easier to use. You know, the spirometer is the gold standard for chronic respiratory diseases. And with this one, we are able to bring it around. It's light, it's accurate. You can also get reports. You get the same graph as we would get using the conventional spirometer. And also, like many people, you know, in the outskirts, they've got that COPD as well and asthma. So this we can pick it up quickly. It's also an upgrade from our smokalizer. That one I would say it's more for smoking cessation, but this one we are actually able to look at the lung function and give them more accurate advice based on the report. We've also got the personalized cancer risk assessment. You scan this QR code and it leads you to a 15-question questionnaire. So it will ask you about your lifestyle, your smoking habits, drinking habits, and it assesses your general risk factors for developing cancer. So at the end of it, if you are given a percentage score, and the higher your score, the lower your risk of developing cancer. So with this score, we can of course advise you on how to modify your modifiable risk factors, you know, like smoking, drinking, and eating too much sugar, consuming too much sugar, so meat, etc. So yeah, we will give a little advice on how we can change it based on the score. I'm sorry about the picture. This was a quick one that I found, but we are getting a mobile truck, so we can come to you better, easier. And I would say that this truck is it's helpful for us because we can do pap smears, we can do breast examinations in the truck, we can do consultations in the truck. I would say these intimate exams, it's better to be performed in a close or safer environment, so people would be more receptive, I say, or more comfortable to get the test done. We will make sure that we can do the test as opposed to doing it in a day one in a hall, you know, with screens or blinds around. This one is more private, so it also has, I would say, maybe or hopefully reassure the patient that yeah, we can get it done, and you give them more of a, they're more willing to get it done. So that's all. I've got to share with you for now. If we can help you in any way, if you feel like you could use our services, please be in touch, and hope to see you soon. Thank you for listening.